I'm Dr. Marla Shapiro, and I'm a past president of the North American Menopause Society. And I'm with Dr. Joanne Manson, who also is a past president of the North American Menopause Society. But she's chief in the Division of Preventive Medicine at Brigham and Women's Hospital, and professor of medicine and the Michael and Lee Bell Professor of Women's Health at Harvard Medical School. And prevention is what so many women want to focus on. And when they think about prevention, they think about vitamins. And you've just authored a recent study looking at vitamins, specifically D, and we talk about omegas. What should women know about this?
Yes, so in the vitamin D and omega-3 trial, VITAL, we tested 2,000 IUs a day of vitamin D and a gram a day of EPA plus DHA, and looked at cancer and cardiovascular disease outcomes. And what we found was that overall, there were no statistically significant reductions in the primary endpoints, but there were some subgroups who did benefit. For the omega-3s, it was primarily those who had low fish consumption, who had less than the average intake of 1.5 servings per week.
So if you're a woman and you're really fish adverse, you potentially could benefit.
You potentially could benefit, and I would recommend talking with your healthcare provider about whether you're a candidate. You'd be a better candidate if you had risk factors for cardiovascular disease, where a supplement might provide some real benefit. But it has to be considered in terms of benefits and risks. Generally, we did document safety over an average of 5.3 years of these moderate doses of the vitamin D and omega-3s.
So for vitamin D, we always talk about winter months, we don't get that sun exposure. Who should be taking D then?
So for vitamin D, we do know that those who have bone health problems, if they have osteoporosis, they've had a prior fracture, people who are older and you're getting very little sun exposure, they're not outdoors, they have low dietary intake in general, may not be getting the foods that have vitamin D, fortified dairy products or cereals or fortified cereals or fatty fish, again, is a source of vitamin D as well as omega-3s. People in those categories may benefit from a vitamin D supplement. Also, people, if they do have bone health problems, osteoporosis, osteomalacia, conditions like that, prior fracture, they may benefit. And we do recommend for people who have malabsorption conditions, such as those who have Crohn's disease, ulcerative colitis, celiac disease, they may not be able to absorb fat-soluble vitamins in particular and other vitamins and minerals, and taking a supplement can be of benefit.
So what about the rest of the world of supplements? Because certainly people will line up multiple supplements. It's quite amazing. And is there anything to that?
Most people do not need a dietary supplement, and in fact, it's better to get these vitamins and minerals from food. They're better absorbed, the micronutrients are better absorbed, and also you get the other benefits of the foods, such as in fruits and vegetables, you'll get the vitamin C, the beta carotene, but you also get the fiber and the other phytochemicals, and everything will be in an appropriate ratio rather than taking mega doses of a single micronutrient. Overall, our advice is more is not necessarily better, and it can be worse.
And that's I think, a really important point, that
Yes.
if you overdose with vitamin D, that's not a good thing.
Avoid megadosing with any of these supplements. Moderate intake is very reasonable. People who are already taking, let's say, up to 2,000 IUs a day of vitamin D or a gram a day of omega-3 fish oil, we're not strongly encouraging people to stop, because we did document safety over 5 years with these doses, and there were promising signals for heart attack reduction with the omega-3s and a reduction in cancer death with the vitamin D.
And one final question for women, particularly midlife women and postmenopausal women, as opposed to young or pregnant women, but the women that are interested in the North American Menopause Society, are there any age-related vitamins that they should be thinking of other than the ones we've just chatted about?
I think a calcium and vitamin D D supplement in moderate to low doses would be quite reasonable because of the higher risk of bone health problems developing. And you don't need to take more than 1,000 milligrams of calcium, even 500 milligrams a day if you're having a reasonable intake of dairy products and other calcium-rich foods. And for the omega-3, well, for vitamin D, I think that taking anywhere between 1,000 and 2,000 IUs a day is quite reasonable for midlife and older women. Some people will need a B12 supplement. That tends to be at older ages, but if there have been any concerns like family history of pernicious anemia, or you've been told of an anemia related to a B12 deficiency, certainly that would be another supplement worth taking later in life.
Terrific. Thank you so much for being with us.
Thank you. Great to be here.